on anyone, but many of the children on our caseloads have maladaptive behaviors, right? Those are bad habits. Sometimes they evolve because in some instances, we have children who learn to speak really, really soon in life. I'm talking 7, 8, 9 months. They're saying words. I don't know if this theory is true, but when it comes to early talkers and how that affects language development, because the muscles of the tongue, the head and neck have not properly I want to say evolved or developed to have the capacity to produce certain later developing speech sounds. So it's my theory that with some of these children, especially on the caseload, who were early talkers, not late talkers, they were speaking very quickly. They were speaking very rapidly in terms of language growth and even rate of speech. However, their articulation patterns remain the same because they created a habit, right? Habits are hard to break. Likewise, we have some who may have developed later when it comes to language ability, if they've developed, fluent language at all. And they've also gotten into some habits. Okay. A habit is what we're doing daily, what we're doing on a routine matter. It's something that we don't think about, we just do it. We want to talk about establishing strong habits. The first part of this is to do the right thing. So if you're doing something wrong, you're going to have a bad habit. For example, singers, when they sing incorrectly, they develop vocal nodules or singer's nodes. Okay, so that habit leads to callousing of the vocal fold tissue, and the callus creates nodes. And they have to get the nodes surgically removed sometimes, but sometimes they can just change their habits. If we catch them early enough, they can change their habits and the nodes resolve themselves. Okay. Same thing with speech and language. It doesn't mean that if your child or your loved one, maybe your mom who recently had a stroke, or your cousin who recently had brain injury, maybe if they do something better, their speech is going to miraculously change. I'm not necessarily saying that, but I guarantee you things can get a lot better if you stick to certain good, strong habits. So a good, strong habit is something that is pointing you towards the direction of where you want to be. Maybe you cannot say a certain sound yet. Maybe your family member cannot respond to questions yet, but the goal is to get them there. So in order to get them there, we have to envision what that looks like. Now, this is really hard for people in our caseload who stutter. They have a hard time envisioning where they see themselves. I actually have a program called See Yourself Fluent, and we work on visualization. So the first part of a strong habit is to know where you're going. Why do you want to be able to sustain phonation for 5 minutes? Oh, I don't know anyone who could do that, but I'm just saying, you have to think about, why do I want them to do this? What is it I want them to do? And how does that look? And that starts, with visualization. Once you kind of have a picture, it doesn't have to be perfectly clear, okay? Just as long as it's heavily pixelated and you can kind of guess the parts, that's good enough to start, because at least you know where you're going. You need to know what the behaviors are to get to that, or what the basic elements of the behaviors are at that level. So as someone who wants to sustain phonation for a long period of time, let's say 60 seconds, well, first they need to be able to sustain phonation for 30 seconds. And in order to sustain phonation for 30 seconds, you need to be able to sustain phonation for 10 seconds, 3 times straight. You get where I'm going with this? So a daily habit might be practice sustaining phonation for 10 seconds. That's a starting point. Each day we might want to grow a millisecond, a half a second, a nanosecond. I don't know, but it takes several days to establish a habit. So sometimes before we want to grow, we just need to establish the habit. That's why most of these programs will say, oh, in a month, I say 60 days. Much of the research shows that 60 days, really 120 days for most people, but 60 days for highly intelligent, highly functional, highly motivated people. Okay. You're going to need 60 days of repeating that behavior in order for it to become a habit, meaning habitual for you, meaning that it doesn't take cognitive effort for you to do it. A lot of the children on our caseload, even adults who've had strokes and have apraxia of speech, right? We're changing habits. So at-home practice is really important, especially if you're doing the practice in the right way, because that's going to help bypass the cognitive aspect of performing the task. And you're going to be able to have neuromuscular programming so that your muscles are able to perform the task without you having to tell them to do so. Okay, it's not necessarily 100% involuntary, but it's moving towards that path. Okay, where the habit pathways in the brain, they're now loops. Okay, the neurocircuitry is clear. There are no blockages. You don't have to think about it. You can just do it. That is the aim here. So that's why it's important to do speech practice at home. Now, many people don't feel comfortable doing the practice without us. And for those instances, I'll say, please let me know. Let Nyla, let someone on the team know if you really don't feel comfortable practicing by yourself at home, because at home practice is critical. There's no way, okay? I mean, there's a way, but it's a low way. Right. I do have certain families who only want, 1 week of speech, one session of speak, one speech session per week. That's fine. But that's going to take about 2 years, right? And I don't mean to over exaggerate, but it's true. Usually, if it's a speech sound problem, now I may be able to help certain people change a speech sound in 2 or 3 months, with one session a week if they're really highly motivated, highly functioning. However, it's probably going to take a year to 2 years, depending on their learning curve and the severity of which we're dealing with the problem, as well as just the integrity of the oral mechanism. That's going to take some time. So the we can reduce the amount of time that it takes if you're practicing at home, if there's some type of carryover exercise, so that it creates that habit loop in the brain to allow it to, bypass cognition and perform the task accurately. You need to perform the task accurately. So many children, I'll just say, brush your tongue, stick your tongue muscles out straight and brush your tongue. That's the habit. Sometimes we'll say, place the tongue on the alveolar ridge and hold it there for 3 seconds, or hold it there for 10 seconds, or hold it there for 30 seconds. That's the habit. We're trying to help to elevate the tongue and put it in the right position to produce certain sounds that, emerge from the alveolar ridge. So make sure that you are practicing at home, even if it's 30 seconds. It should be daily. Okay. If you cannot do it daily, try to do more days than less days in a week. So if there's 7 days in a week, which I think there are, then that means you at least need to practice 4 out of the 7 days in order for you to practice more days than less days in a week. Okay. And that's not even 60%. That's like 58%. So I guess we could say it's close to 60. That's a D. All right. So if you're practicing, 5 out of the 7 days, now we're getting a little bit better. We're in C territory. You need to practice more days than less days out of the week. It doesn't have to be a long practice. In fact, it shouldn't be a long practice, because then you'll hate it and you won't do it again. Also, you cannot practice for a long time and think that that makes up for the lack of practice on certain days. It doesn't. The brain needs rest in order for it to neuroprogram. So if you're practicing for an hour and you think, oh, I can skip the next 2 days, it doesn't work that way. It's better to practice for 5 minutes over 3 days than for 5 hours on one day. Okay. Now, obviously, there's some learning that goes into effect here. So I'm not saying that long sessions aren't helpful. Of course, you need education, information, drills. However, when it comes to practice to build the habit of a specific skill set or skill, short durations are more than fine. They're actually preferred. So I'm going to leave some resources on the blog today, just some posts, maybe from like James Clear. I think he has a book on atomic habits. Charles Duhigg has a book on habits. Tiny Habits, I think someone has a book on tiny habits. Um, of course, The 7 Habits of Highly Effective People has nothing to do with speech therapy, but it's a wonderful book on habits. And it's really about how to be effective in your life. And I think that there's a lot that you can take from that. However, I really do suggest talking with me, talking with your speech therapist or whoever you're working with, to figure out what is the lowest common denominator here that you can address as a daily habit. How can you integrate that into your routine so that it's something that you're doing automatically and you don't really have to think or plan to do it? Okay. We can talk more about habits. I can go all day with this, but I want to leave this with you. I think this is enough to ponder for now. And I'll catch you on the next one. Bye.